As another day dawns in Liverpool, staff at the Royal's emergency department are hard at work.
Which one?
In resus, Dr. Kate Clark is called to see 20-year-old Ryan Naylor, who's been brought in on a spinal board.
This Ryan, can you tell me what happened?
Trying to climb up a drain pipe. I think I'm Spider-Man and fell.
How high up were you when you fell?
3 stories I've been told.
Trying to climb in the window?
Yeah, I was really close.
Not close enough though, unfortunately. And then, do you remember how you landed?
On my feet.
Okay.
On my feet, but I just got a shock up my back.
Right. What we're going to need to do is have a little look at you. So bear with us, we'll get everything done as quickly as possible, all right?
Yeah.
The risk here is that shockwave can be transmitted up to the back as well. The injury to your spine, that's very serious. That's why he's in the resuscitation room. Okay, what I want you to do for me now is spread these fingers out wide apart.
Kate begins a series of tests to discover if any neurological damage has occurred and if there is a risk of paralysis.
Is that painful?
Yeah.
Is it pain that's stopping you from moving it? Okay. We'll let you rest that back down again then. Right, what I want you to do for me now is this leg. Can you try and lift it up off the bed at all for me? No? If you can't, that's all right. That's okay. That's fine. What about this one? Okay, is that with the pain in your back?
That's worrying, that's it.
Is it very painful when you try and do it?
It is, and it's worrying.
Okay.
The fact that I can't move it.
So don't worry, don't worry. Okay. Can I have some people for a vlog roll?
Hiya.
He's not had any pain in his neck.
I'm going to control your head, all right?
Yeah.
This was a good idea, wasn't it? Was it every week?
Go on, climb up the drain pipe.
1, 2, 3.
That's all there. Okay. Really sore, isn't it? You're doing really well there, mate. Really well.
That's right.
Okay, you've done really well now. I still want you lying still, okay? Do you want blocks? You all right?
I don't feel like a good
No,
walk
you're not walking anywhere, okay? Because I am worried that you've done some damage to your back. Okay, you are very tender down your back. So we need to keep you still as possible while we do some x-rays.
If Ryan's x-rays reveal spinal damage, he may never walk again. Associate Specialist Rob Hunter is also on duty. His next patient is Michaela Baker, who's come in complaining of panic attacks.
Hi, is this Michaela? Hi there. When did all this start?
Yeah, just today, because of those little really panicky Saturday.
Did you get short of breath with it at all, or lightheaded? You get short of breath, yeah. You've basically got a very fast heart rhythm. It's quite a common thing. Essentially, there's a little bit in the heart, there's an extra bit of tissue that conducts an extra impulse, and it sets up a circuit that makes you beat very fast.
Michaela's underlying heart condition triggered her feelings of panic.
Is this serious?
No.
Is my heart like healthy enough to go to the gym and everything?
Yeah. It's not harmful. It's just annoying when it happens.
Is that serious now?
Honestly, it's not serious. It looks like a thing called SVT, supraventricular tachycardia. You can get this at any age, but it's unusual to see it at someone so young.
At 17 years old, Michaela is understandably very anxious.
I'm going to give a drug called adenosine, which usually corrects it within about 15 seconds. Just relax, don't worry. Adenosine going in and out. Just nice and relaxed. Very good.
Just breathe normally.
No. That's a pity. Usually what I'm...
Despite his best efforts, Rob has yet to convince Michaela that she's not in danger.
Is this life threatening?
No. This is nothing to worry about, honestly.
See, this is what I mean, I question myself.
If I thought this was something for you to worry about, I'd be bringing you in. I'm just going to give another drug. You have to give it over about 20 minutes, half an hour by infusion. It's an antiarrhythmic drug.
Is this life threatening?
No. How many times do I have to tell you?
That's why it's not going down, isn't it? Because of me.
Because you're getting all worked up.
It will take time for Michaela to calm down and for the drugs to kick in. So Dr. Peter Williams, who's just started his shift, takes over from Rob.
Where I say, this is Dr. Williams. He's going to check you over once all this goes through, this drip. Okay then. She's very, very anxious. I don't know nothing anxious about it. She keeps thinking it's a life-threatening condition. And I've told her about 6,000 times that it's not.
It's not serious.
It's not serious, no, but we'll get you sorted out. The most important thing is that we get your heart slowed down now. And you feel back to normal.
Relax.
Yeah. And don't panic. Alright.
A doctor's work is not all medical. On top of paperwork, senior doctors like Rob have a range of responsibilities.
I'm the trust lead on major incidents, chemical, biological, radiation incidents, and we're having a training day for the senior nursing staff, simply because I've got a lot of new equipment and a lot of new toys to play with, and I'll see what standard the staff are at.
115 emergency call, please, for diabetic male with possible hypo.
Out on the streets, paramedic Jason Sefton is starting his 12-hour shift.
I've been given an emergency call. It's in the Liverpool city centre and it's in a sandwich shop, and this is a male who's about 40. He's diabetic but currently is still actively fitting, so I mean we'll get there as quickly as we can. It's potentially life-threatening because when you're fitting you continue to use your muscles, you continue to use more oxygen, more sugars, no sugar in your blood, nothing to feed your brain, you will die.
When 40-year-old John Davidson realised his blood sugar level was falling, he headed for the nearest sandwich shop.
How long
He was queuing for his life-saving lunch when he started fitting.
When did you last have your insulin? That's normal. You're a bit sweaty, you look a bit hypo, to be honest with you. What we're going to do is test his blood sugars, see if it's a diabetic fit he's had. Your BM's 1.8. That's very low.
All these people go outside and you know.
Yeah, you come and sit outside.
Jason administers some very simple medicine.
There you go, Squire. Cheese toasty.
I was just going for my dinner and then started sweating, and then obviously it got too low, a bit quick. Just need some food down me now and get my blood sugars back up.
We couldn't believe he was in the queue for your dinner. In the queue for his dinner and that happens, but I'm always done, told the crew that the gym doesn't want to come to hospital. I'll do his PM in a minute. If it's within normal range, I mean, I'm more than happy to just say, carry about on your business.
I feel okay now. It's a bit tingly, still a bit tingly, but a lot better than what I was in there.
There you go. His BM's now reading 3.7. That'll do. We can let him go. Another life saved, eh?
All down to a bit of toast.
Yeah. Right.
All right,
cheers, take care then. All right, see you now.
All right,
ta-ra.
thanks.
Done. So that is, honestly, a life saved by a cheese toasty. Unreal, isn't it? You know.
In Resus, Ryan and his mother Julia are waiting for the result of his x-rays.
He's
so active, he's always been sporty and he loves the gym and everything, and it's just the silliest thing that could happen, really. Well, hopefully you'll never try that again, will you?
I know.
Can't believe he even tried it.
The type of job I'm in, labouring, you know what I mean? I need me back to be sorted for that, but just take it one step at a time, isn't it?
Right, these are Ryan's x-rays. So he has got an injury here. So this is his, what we call his first lumbar vertebrae, so it's about here. This is a normal one, and then this is the one, and you can see how that's squashed down. This is both of his wrists. Oh gosh, that's a nasty one, and on the left side, it's just shattered. His right wrist, he's chipped a little bit off his scaphoid bones. How are you doing? What would you say about your x-rays? Okay. There's no sign of any injury to your spinal cord, the bit where all the nerves are that can cause paralysis and all that kind of thing.
I was dreading you coming in. I was thinking what I'm going to get told now, but
I know.
I'm relieved, really.
Luckily, well, I'm relieved as well, because I was quite
really
worried
worried
about what injuries you may have, because you're quite sore in quite a few places down your back. But one of the bones has been squashed, so there's a likelihood that you are going to get pain in your back when you know, from time to time.
At least I can still walk. That's okay for me.
Unfortunately, with your hands, we would ideally want to put them both in plaster.
So I'm just going to chop my hands off. I'm okay.
Well, that's the thing that's going to cause a problem, because once you go in this plaster, your hand is stuck like that. So if we do that with both of you for 6 weeks, it's quite difficult for you to actually sort of move and use your hand.
Just take it gradually, isn't it? Oh, thanks a lot. Thanks a lot. I'll do. I'm relieved.
It's always very nice when somebody comes in if they're not well and you can manage to make them feel better and you can reassure them that it's not serious.
In Miners, 39-year-old Gary Douglas is waiting to see Peter.
I was laying on the couch on Saturday night without my normal slippers on, great big pair of Dachshund ones, and I thought, well, I'm not going to wear these, I'm a little bit clumsy, so I took them off, got up and then... splinter of glass.
You alright there? Oh. You've been just hobbling round, thinking it'd get better?
Yes.
So, what I'm going to do is put some local anaesthetic in. This is going to be a little bit painful when it goes in. Hold on. A little bit of stinging. That should start taking effect now.
Oh, that does bring tears to your eyes.
It does. Does that feel alright?
I can't feel anything at the moment.
That's ideal. It's painful at all, just tell me that. I can always put some more local anaesthetic in. It's a tiny little bit of glass, and often, once it's gone underneath the skin, it moves a little bit. So, it is very tricky.
Yeah.
It's not a lot more complicated than you think it's going to be.
It just manages to cause a hell of a lot of pain.
You alright? We can see that there's definitely a bit of glass in there, just can't quite grab it. Just put a little bit more locally. Got a couple of bits of it, but I know where it is now, which is a good start. A big bit of glass has just fallen out. It's probably fallen inside my shoe. I'll be demanding a general anaesthetic. Not having somebody needles around in my foot.
Brilliant, thanks very much.
You're welcome. You're welcome.
Quite stinging quite a bit, but if he's got most of the glass out, that's all I'm bothered about. But it's just learning a painful lesson.
Hello, Majors.
Ali Mannion is the sister on duty.
Could Dr. Rob Hunter contact Majors immediately, please? Dr. Rob Hunter to Majors. Hiya, Rob. Just had a phone call from ambulance control. There's a major chemical incident. Heavily contaminated. Full chemical deployment required.
Right, fine. Put in all points for code green, please.
Attention all staff, this is the code green. Attention all
Although this is a training exercise, the staff react with the seriousness of a real incident.
Deploying the chemical decontamination tent, certain designated personnel getting into personal protective equipment to start receiving casualties.
I'll be dealing with patients that are contaminated with what we believe is a nerve agent.
But there are 6 people unaccounted for making their way to either A&E here or a walk-in centre, so they could arrive at any minute. If you're not in proper equipment, then we can't treat them.
We need to basically rinse the patient down with sodium hypochlorite solution. From there, the patients will be rinsed, and then effectively they have been decontaminated.
Very, very good. Excellent. Well, went better than I thought, actually. They got it up in record time, so I'm very pleased with it.
I think that went really well. Everybody worked together as a team. I guess every one of us hopes that we never have to do that for real.
Jason is on his way to his next patient.
I've got an emergency call, and this is in the Anfield area of Liverpool. It's a 35-year-old male who's vomiting blood. He is conscious and breathing. It is a red call. It's thought to be serious or life-threatening.
John Grimes is a long-term alcoholic.
What's been happening with you today, then?
Who's recently tried to stop drinking.
We got told you've been vomiting blood, is that right?
It's only a little bit. I've been drinking again.
You're back on the ale, are you?
Yeah.
Yeah. Just honestly, try and keep your breathing nice and calm. You're just breathing too fast. You're all worked up and panicky, aren't you? Right, just relax. Just in through your nose. Out through your mouth. It's set to 98, and his pulse slight tachy 106. It's bound to be you're worked up. You know, you're agitated. You're alone here. You live alone. Yeah.
I'm scared.
I can see that. You're terrified. Don't be, honestly. You'll be all right. Come here, let's get you sorted out.
Years of alcohol abuse have left John with a catalogue of medical problems. His relapse has aggravated them.
He's going to be all right. He'll live another day. He will. He needs help. He needs to get off the drink, though. We don't deal with, you know, the moral issues of, you know, whether he's good for society, bad for society, whether he likes his grandmother or not, or whatever. We save lives. Doesn't matter who you are. We'll look after you. Yeah.
Sister Carmen Aspinall goes to assess his condition.
Hi there, is it Mr. Grimes? Hiya, my name's Carmen, one of the sisters. You stopped drinking about 5:30 this morning. Yeah. Have you tried to come off the alcohol at all?
Yeah, I've tried my best, but...
Was it shorts or beer, cider, vodka? How much did you have, love?
half a bottle. No, we have more.
How long have you been drinking this much for? A long time?
Yeah.
Yeah.
Wow.
Okay.
Oh, God.
Okay, don't worry, we'll sort it out, okay? Okay. We'll come back and we'll take some blood tests off you.
Okay.
All right, we'll take it from there. All right. Okay, look. So I'll leave you to pop the gown on and I'll be in to you in a minute, okay?
Thank you.
All right, look. He's got quite a few risk factors there. Vomiting up blood sort of suggests a gastrointestinal bleed. I would imagine he'll be being referred to the medics and being kept in.
I've got an illness what I can't get over. And people think it's easy, but it's not. And I'm stupid, won't listen to what the doctors say. And before I'm 40, I'm gonna end up dead. And I'm scared. I don't want to die, I'm only 35 years of age.
Kate's next patient is 17-year-old Nikki Baker.
Hello, is it Nikki? Just tell me what happened today.
I was trying to put on some sand skirtings at work, trying to flick the edge up with a knife, and I obviously slipped on my one, because I'm only the apprentice. It's gone straight from my front.
Right.
I think it's gone through the other side.
It has. So it went in this side, obviously, and come out there.
Yeah.
Can you bring your thumb across and touch your little finger? Is that sore? That's sore. Right. What I'm concerned about is whether or not you've damaged any of the tendons. So if there is evidence of damage, they may need to go to the theatre for that. But we'll be able to see when we have a look. Hopefully, we'll be able to just give it a clean up and then wash it out and put a, well, I think probably a couple of stitches rather than a plaster. Big blade, wasn't it?
Don't like needles then.
You're going to have a little injection to numb it. You're going to feel a sharp scratch now. You okay? You're doing great. What we'd want to do is make sure that anything that could be stuck in there comes out. If there's any infection or any serious injury, it could mean he could lose the use of his thumb. The cut actually goes in here, which is just tunnels under the skin, not actually into the muscle or the tendon. Okay, these are a few stitches. Any wound is going to scar no matter how well you close it, but it's got to look the neatest. What we'll do is just give it a clean up, get rid of all that blood for you. Okay.
Thank you very much.
That's all right. So we'll get somebody to come and sort your dressing out and then we can let you go. It's got busy again, just as I'm about to leave. Ill people don't work to our schedule. They all seem to come in between 7 and 8 o'clock just when we're all getting ready to go home. You always feel like you've not done a good job when you leave the department full of patients waiting to be seen.
182 emergency message, code red. RTA, patient is critical, hot response.
Ambulance crew Paul Smith and Ian Doyle are already responding to the first shout of their night shift.
Well, one vehicle is a taxi and looks quite badly damaged. Connor said there is smoke coming out of the vehicle and there's possible entrapment. Oh, everyone's here. Fire brigade, the lot. Oh! You might as well stand up.
All right, darling. All right. May I mean, what's your name?
Gemma Moffat and her boyfriend Stephen were on their way home from his 23rd birthday party when their taxi collided with another car.
Minute, we're sorting you now. Don't worry, don't worry. Nothing to be scared of, darling, all right? Nothing to be scared of. No, not anymore. Just give me my green bag. Get us a stretcher. She's got a mega thigh god, mega shin god. I know you are, darling. Just getting the gear out. We're going to sort your leg out. We will get you comfortable, but we've got to get you out of this awkward position. If you want to scream, scream. No, hold it out, OK? No. All right. No, no, no. You're a brave girl.
Gemma is trapped in the wreckage and must be cut free.
All right, darling, cover your face. Brilliant. That's brilliant. We'll have to straighten this leg the best that we can.
All right, babe.
Well done. It's done. It's done.
Ready? 1, 2,
go. Brilliant. You're there, darling. You're there. You've done brilliant. Oh, here we go. This way along. That's brilliant. All right, darling. Are you still with me? Well done. I know it is, darling. Steady, Paul, when we go round the way it is, all right.
Her boyfriend Stephen managed to walk away from the wreckage.
You all right?
Paul, can we have a standby, mate, for a 24-year-old female mid-shaft, right leg, broken left leg, and head injuries. We're going to go right now. Turn up, darling. I'm going to have to pop a little needle in, all right? Oh, this is something give a pain relief. Couldn't get at you in the car. So taxis need seatbelts, isn't it?
I've opened up on you.
Well, who does?
Give me loads of that, please.
Yeah, I'm getting you comfortable, don't you worry. Well done, darling, that's it. Because she's got major trauma injuries to her legs, especially in the mid-shaft, you can lose quite a lot of blood. But all her ups are quite fine, a little bit of tacky. So what I'm doing, what blood loss she's lost, which you can see on her leg, her leg's like that, swollen, I'm replacing. Nice and steady, Paul. Cheers, mate. It's all right, darling, I've got you. Don't worry, don't worry, don't worry.
We cannulated him on minors and he just...
Sister Ali Danvers and Dr. Peter Chamberlain have just started their night shift when Robert Brett from Barnsley comes in, following a bit too much rough and tumble.
We were acting about wrestling. He got on top, he grabbed my arm and pulled it straight out of the socket. Yeah. My friend there.
It's my 21st birthday. Didn't expect to be spending the night in hospital with my mate.
Not me,
but things happen, don't it? It will fall over.
Right. What you've done to me? Look what you've done to me, hurting me. I told you not to do it, and you did.
Is this what happened to you the last time when it came out? Yeah. And did it go back first time?
6.
6 attempts?
Yeah.
Did you hear that, guys? On the previous dislocation, it took 6 attempts.
OK then, we'll just give you a little bit of this. Midazolam, alright?
To make you feel a bit sleepy. Okay.
Give me a bit more, it's not making me go.
No, it will take a few moments, alright? We're not rushing.
Right,
just put your head
relax.
back. OK.
Just give me the message what you
Robert,
can do.
just relax now.
Just relax his shoulder. Alright.
OK, mate.
James?
OK.
James?
Some oxygen on, is that right?
All right, Robert, that's just an oxygen mask, OK? You should have let me do it in the first place.
Nurses, man, they always know the best. Alright?
You want to go?
Yeah.
Yeah, here we are, that's all done. Back in now. All right. So we've managed to pull the shoulder back into place. So he's going to have another x-ray now, just to ensure that it is in the correct place and sleep off his sedation and hopefully go home later on tonight.
Robert, how are you feeling?
Okay.
How's your shoulder feeling?
Okay.
Is it feeling good? Excellent.
With Robert recovering, Ali gets ready to receive Gemma into resus.
You all right, Jem? Well done, darling.
Well done, sweetheart, you did fab.
All right, Gemma. I'm collision with another car. Looks like quite high speed. Like you say, head injury there. Yeah. I feel it has gone. How many places? Hands all over right leg. Apart from that, blood pressure 133/85. Rest of it great. Thank you very much.
All right, sweeties, you're going to be fine.
Yeah. Well in.
You're doing really well. All right.
Come over, Gemma. My name's Pete. I'm one of the doctors here. Where's your pain worst at the moment? No pain in your tummy or anything like that? Good. Any health problems normally? Just look at my finger and just follow it with your eyes. Good.
You're doing great, Gemma. Brilliant.
We will definitely go easy with your legs, don't worry. Whereabouts is this one? So is it in your thigh? Just checking it over with Gemma's major systems to make sure everything's okay. And then having a look at the legs, which is obviously the most injured part of her at the moment.
All right, my love.
All right, sweetheart. I'll give you another injection for the pain, Gemma. All right. Looks like she's broken a femur, which is the main bone of the thigh on the left side. She may possibly have a fracture of a tibia and fibula, which are the shin bones on this side. So we'll need to get some X-rays of both of those to make sure they're okay.
All right, Gemma, nearly done.
Stephen's injuries are not as serious, and he's waiting to be treated.
I feel a bit shaken up and worried about my girlfriend, as she's got more injuries than me, but hopefully she'll be okay, and good birthday after all anyway. But a terrible end to it.
We're going to ask you a lot of questions when we get you off this border.
I'm
just scared. No, don't be scared. We do this for everybody that's had a car accident, all right?
You're okay.
You're doing fine. Honestly.
Don't worry.
You're Then we're going to just get lots of x-rays done and see if you've broken any bones. All right? Okay. Do us a favour, just pull those curtains across. 1, 2, 3. Oh!
Well done,
All right.
well done.
Remember what I said, no nodding, just say yes
Any
or no.
pain at all down there?
No.
Is that all right down there?
Yeah. You're doing wonderful. That's brilliant.
Got it.
Where's that hurting? Is that your legs?
Your legs.
All right. All right. Your neck and your back are fine. All right, Gemma?
It's all right. Get you sorted out. Don't worry. I'm going to take these things off and just make sure you can move your neck about.
Yeah.
Are you Gemma's mum?
I'm Gemma's mum, yeah.
I'm the doctor who's looking after her.
Yeah.
We're going to take her out to X-ray now. Just wanted to make sure everything was supple. She was nice and stable.
Can I go with her?
Of course you can.
Okay.
All right.
That's fine, thanks. Just come in with you. Okay, okay. Okay.
Just go see these what
Don't be worrying about things. Just get yourself sorted out.
Let's do Jem.
Gemma? Gemma? You alright?
I'm alright.
Sure? You alright? I'm here.
He's here. You alright, Steve?
Yeah, you alright?
Yeah.
Don't worry about me.
He's fine. He's walking.
Hey.
Got socks on.
You get the dog now, Steve.
Okay. Well, these are the x-rays of Gemma's legs, and it does confirm that she's got a really, really nasty fracture of the left femur, and that's almost certainly going to need surgery and a pin putting down it. And then she's also got quite a nasty fracture of the right tibia and fibula as well. There should be a nice smooth line down both sides, but the bone's split down there, and then there's also some fragments come off as well. Hi, Gemma. The x-rays of your legs have showed that unfortunately you've broken both of your legs. I'll get the orthopaedic doctors to come down and see you down here, and then we'll move you to an orthopaedic ward.
I will need more operation.
You will need an operation, yeah, then they'll both need an operation. Okay. All right.
Ryan wore a back brace for 3 months and had physiotherapy. He hopes to return to work soon. Michaela was kept in overnight and has undergone further tests. And after a 7-hour operation, Gemma spent 3 months in a wheelchair. She has now started walking again.
Stay with us, Sensei, for more Trauma Uncut next on BBC 3.